And you accept the recording, right? So you know that you're being recorded by virtue of clicking the button, and that's your acceptance. Keely, good morning.
Good morning. I'm sorry I had to unmute myself. Thank you for inviting me to this meeting. I'm Keely Harris from the G6 PD Deficiency Foundation. It's an enzyme deficiency that is pretty common. About 6% of Americans have it, but no one's ever heard of it. And it's something that our foundation was put together to bring forth awareness, education, as well as informing the medical community. We're kind of like a hybrid. Not only do we service the public with information, but we also service the medical community as well in regards to this enzyme deficiency. So I'm here today to see what this is all about, and hopefully I can bring forth awareness to this community as well.
Okay. Jessipina.
Hello, I'm a health educator from the Stony Brook Cancer Center Office of Community Outreach and Engagement.
Hi, nice to meet you. Sue Ann. Okay, Sue
Hi,
Ann.
everyone. My name is Sue Ann Villano. I am with HealthX in the Support Services Department, and I actually brought in two of my colleagues because I used to attend this meeting regularly and miss it dearly. We merged. We used to be New York Care Information Gateway. I used to be with New York Care Information Gateway. We merged in 2020, and so I just wanted to get us more involved. And my two colleagues, Lori and Nan, who are on the call, will introduce themselves. They are part of our business development, and I wanted them to be ears on, hearing all the great people that you work with, Janine, and all the needs of the community of Long Island that I haven't been listening to for a while, that maybe HealthX can help address, as we are the health information exchange for all of the hospitals on Long Island. So they are, we're just here to help, and hopefully there's more room for us to do so in the near future. So thank you for having us.
Sure. Hey, Chris.
I am Chris Hendricks. I'm the Vice President for Community Outreach for Catholic Health.
Lori Harris.
Hi, can you hear me?
Yes.
Hi, so Sue Ann already did a lovely introduction. My name is Lori. I work with HealthX for an HIE, which is a health information exchange, and I am part of the business development side. And we came to attend to see what's going on Long Island and see where we can be of service in helping to connect companies, organizations.
Thank you, Jack.
Good morning, I'm Jack Clement. I work with Northwell, as you said earlier, and I am preparing for the 11-15 Medicaid waiver coming down the pike. So happy to listen this morning. Apologies as I'm in transit, so I'm just listening for now.
It's okay. Cleopatra.
Hi, good morning. I'm Cleopatra. I'm north of Peconic Bay and basically community outreach associate, mostly focusing with preventative methods, education on lung, breast, and prostate cancer.
Karen Kirschbaum.
Good morning, everyone. I'm Karen Kirschbaum at Western Suffolk BOCES, and I'm a school community wellness coordinator for the Creating Healthy Schools and Communities grants. We work with towns of Babylon, Islip, and Hempstead on improving access to nourishing foods and opportunities for physical activity in both the schools and community settings. So I'd love to hear from any of you who I haven't met with. Good to see you.
Alicia Gibbons.
Good morning, everybody. My name is Alicia Gibbons, and I also work with Karen Kirschbaum over at Western Suffolk BOCES under the Department of Health, New York State Creating Healthy Schools and Communities grant. Thank you for having me.
Sure. Alexandra.
Hi, everyone. I'm Alexandra San Juan, and I'm the Health Access Supervisor at Make the Road New York. Sorry, I haven't been here in a little while, but I'm so happy to be back and join this wonderful meeting. We are a nonprofit organization. We located in the 5 boroughs, but the office in Long Island is located in Brentwood, and we offer different services to the community, immigrant community, but we also do a lot of work working with policies and campaigns right now, working in the Coverage for All campaign, hoping that it's gonna be in the budget, in the state budget this year. So glad to hear from everyone today.
Welcome. Kelly DeVito.
Hi, I'm Kelly DeVito from Horizons Counseling and Education Center, which is an outpatient substance use program in Smithtown.
And Dr. Mermelstein. Yeah, Dr. Mermelstein.
Hi, I'm Linda Mermelstein. I'm the Associate Director for Community Outreach and Engagement at Stony Brook Cancer Center.
Good morning, Lucy Miller.
Good morning. I'm Lucy Miller. I'm part of the Community Engagement and Health Equity team for Memorial Sloan Kettering.
Good morning. There's another Kelly DeVito, but it's a different one.
Yeah, so no, I'm not Kelly. I just used her link. I'm Maddie McBillion, but I'm also from Horizons Counseling and Education Center.
Hi.
Hi.
Annalee Trask. Hi there.
Hi, good morning. My name's Annalia Trask. I'm with Stony Brook Cancer Center. I am the program coordinator for the Cancer Prevention and Action Grant within the Community Outreach and Engagement Office. And I'm glad to be here. Thank you.
Hi, Danielle Graves, I think it is.
Yes. Hi, I'm Danielle. I'm a community health ambassador at Northwell Health.
Nice to meet you. Joseph Sano.
It's Joseph Sarno from NADAP, National Employment Initiative.
Nice to meet you. We know who you, you can say who you are.
Oliveri, manager of the Long Island Health Collaborative.
And technician extraordinaire. Move it ahead so I can see.
Yeah, well, Lauren, right?
Oh, Lauren Fish, and then there's a hyphen, so I don't know the rest of it.
So good morning, everybody. My name is Lauren Fish Henry. I'm the Senior Breast Health Educator and Marketing Associate with the Mora Foundation.
Good morning. Maria McHugh.
Oh, Maria, let me know this before.
Okay, Maria.
Thank you.
But great to have you here again, Maria. Sarah. Yes, I don't see the rest of the names. So Sarah.
Hi, my name is Sarah Yashra Gershman. I'm a member of the Be Free team, the Breastfeeding Resiliency Engagement and Empowerment team at Northwell.
Hi. And then Brunette. You with Healthix, I think, right?
Hi, good morning. Yes, I'm with Healthix. I am on the customer engagement and business development side. So looking forward to hearing the topics from today's discussion.
Nancy O'Keefe.
Hi, good morning. I'm Nancy O'Keefe from United Way of Long Island.
Hi, Nancy. Okay.
Who's next? Nikki Stewart.
Nikki Stewart.
I don't know why we can't see everyone.
Hi, sorry, trouble unmuting. I'm Nikki Stewart with the Witness Project of Long Island. We do breast and cervical cancer education and outreach, primarily in the African-American community.
And Katie Ramirez.
Oh, you can't see my camera. I'm sorry, everyone. Good morning. I work with Nancy at United Way of Long Island. We work under the Ryan White Part A HIV grant and oversee about 14 agencies for services on Long Island.
Holly.
There I am. Sorry. Hello, everyone.
Hi.
Good morning, everyone. I'm Kali Chan. I'm the Director of Medicine Media Relations at Stony Brook Medicine Healthcare System. Looking forward to the conversation. Thank you.
And Jackie, we'll hold off on your intro when you're ready to speak, if that's okay. Jackie is with the Fair Media Council, and she's got some fantastic information lined up to share with you. Good morning, Zareen. Haven't seen you in a while.
Thanks.
Good morning, everyone. I'm just so sorry. Life has been overwhelming. One, getting into COVID and then getting out, both have been a struggle. I'm Zareen Bajwa. I'm the director for community education at Cornell Cooperative Extension, and there are a couple of very good programs under us, including nutrition, health, parenting, and diabetes.
She's up there. Where'd she go? She's upper left. And then who else?
Vincenza Caruso.
Good morning, everyone.
Morning.
Are you able to hear me?
Yeah.
Okay. I'm Vincenza Caruso. I'm an associate program manager at Northwell Health.
Nice to meet you.
You as well.
Who else has not gone?
Who else has not introduced themselves on the Zoom? I think we got everybody.
All right.
I think we got one. So now we'll go quick in the room. And the way it works is the camera, once the person starts speaking, it will find them so that everyone can see you. But there's a little bit of a lag. So just those who are on the Zoom, the person may be speaking, but we're not there yet. Just keep that in mind. So we'll start on my right.
Sure. Good morning, everybody. My name is Alexandra Forte. I am Director of Operations for Long Island Select Healthcare.
Good morning. My name is Josephine Pizzaro-Caccaro, and I'm the Director of Virtual Care and Care Management at Long Island Select Healthcare.
Hi, good morning. My name is Sarah Hennis, and I work for the Suffolk County Department of Health.
Good morning, everyone. My name is Alyssa Sarabian. I'm the Director of Communications for the Nassau County Department of Health.
Hi, everybody. I'm Taylor Levanti. I am the Account Manager for Eastern Suffolk County for New Horizon Counseling Center.
Good morning. I'm Dijon Strange, and I work for Peconic Bay Medical Center in New York State Department of Health through Cancer Services at Northwell Health.
And I'm Janine Logan. I'm Director of the Collaborative and also Vice President Communications Population Health for the organization that manages the Collaborative, which is the Nassau Suffolk Hospital Council.
I've already introduced myself, so.
Hi, I'm Nadine Wilches. I'm the CEO and founder of Mind the Class, a startup doing community intervention for preventive mental health.
Good morning, everyone. I'm Karen Cummings. I'm the Manager of Community and Government Affairs for Live On New York, and we facilitate all the life-saving transplants in the New York metro area. So everything from Long Island to Poughkeepsie, about 70% of the state is overseen by Live On New York. So our goal is to save lives.
Good morning. My name is Harry Gordine Adams. I am the Program Director for Health Homes with NADAP.
Hello, I'm Gina Caporasso, also with NADAP and with Harriet, and also Joe Sarno. But again, we just merged with Project Safety Nets, and we're now expanding into Long Island with our Health Homes program. I'm the Director of Operations for the Health Homes program.
Hi, everyone. Erica Karp, Community Relations Representative for Stony Brook University Hospital.
Great. So I think we got everyone. If not, just unmute yourself and say a quick hello, but I think we did catch everybody. So with that, we'll get started. Try to make sure these meetings are fun and entertaining, number one, and that we come to real solutions, right? So there's nothing worse than just meeting to meet, right? So we're very solution and action oriented. So just keep that in mind as we go through. The first item, I just want to give you a quick update, one of our updates. We did our welcomes, right? A quick update. I can't see with these are for reading, so I can't see distance. Oh, and I have her over here too. See, this is why I need her. As you know, the Long Island Health Collaborative, through all of its partners, all of you around the table, all of you on the Zoom, we distribute a community health needs assessment to the general public, right? And that's through convenience sampling, because it depends on who you can get to take the survey. So oftentimes it's placed at health fairs, or it's We certainly send it digitally, right? We boost it on Facebook and LinkedIn and Twitter, wherever we can, and we ask everyone else to also do that. So some years we get more responses than others, but that's a limitation of that particular survey and the way we're able to roll it out. Someday I hope to be able to do perhaps a random sampling and of households and get a really, good response. But anyway, so we looked at the results from all of 2021 and, right, to 22. All of, what year are we in?
I know.
2023, right? Okay. We looked at all of the results of 2022 in early 2023. That's what we did. We analyzed them. They're on our site. There is a summary report that is in the back at the table. I also have it here. I also am just ready to send out a release highlighting the results from the last survey analysis and then some comparisons to previous years. That's a great thing about this. It's been in place for 10 years, so we're able to see some trends over time. And if you look on the website, you can see that. One trend that I've seen over time and that we documented through some secondary analyses is that Long Islanders have a little bit of an uptick in our physical activity, a little bit, at least when I looked at it a couple of years ago. So that's good. One persistent issue and concern of both individuals and communities is obesity and weight loss issues. It's been in the top 5 for the past 5 years. And of course, as you know, obesity, risk factor for all kinds of chronic diseases, right? It's highly prevalent. Although the obesity rates here in Nassau are a little bit lower than the state level, correct me if I'm wrong. And Suffolk's just a tiny bit higher. You saw that perhaps on the county health rankings that were released yesterday, I think. So we're doing okay. I like to think that's the effect of collective impact. All of these different organizations, everybody working in your own way, in your own programs, your own services. Collectively, we are moving the needle. Does it happen as quickly as we want? No. But over, as I said, these 10 years, I have seen positive improvement. So that's a win for everyone. And you should embrace that and you should congratulate yourselves for that because you're the guys who do that. I just look at data and whatever. And talk about it a lot. In fact, I'm trying to get Newsday to do a piece on this survey, speaking to a reporter later, so hopefully that'll happen. So there's a full analysis. You can go in there, it's open for everyone, it's public data. You can use the Power Pivot, it's an Excel Power Pivot tool. There's also a tutorial on our site as to how to use it. If all else fails, you can call Brooke and me, although we're probably not as much help as the tutorial on the site, but we can help you through it. And you can create your own reports, whatever you might need, right? So if you want to look at a particular zip code or a particular geographic, particular disease state or social determinant of health indicator or certain race or ethnicity, you could do that. And then, there's the press release, which you can, I have no trouble if anyone wants to use this and pop in somewhere that you're part of this collaborative, you can then take some ownership and use this for yourselves and your community newsletters and whatnot. We are part of this Long Island Health Collaborative, whatever the name of your organization is, you can certainly do that. So that's that. Okay, so Jackie, are we right on time?
Yeah,
You're
I think
right
so.
on time. Now, this is going to be a fantastic presentation. No pressure, Jackie. No pressure.
You're making me nervous. Yeah.
No, I'm making myself nervous. No, Jackie is, Jackie, do you know that I remember when you first started at, well, it was the New York Coalition for Fair Broadcasting then, right? Way back when?
Long Island Coalition, yeah.
Long Island Coalition. I remember when you started and it was at the Folio Awards, I think, that were held at Uniondale Marriott.
Possibly, or Crest Hollow. It was at Crest Hollow
And
Courageous.
I remember you being interviewed by News 12 because you were taking over the role of executive director of this organization. So that's when I first met you. I won't say how many years ago it was, Jackie.
Thank you.
That would be fair to me or to you. But I do remember that. And I have to say, through the years, Jackie has, she's really taking the reins of this organization and knows the media landscape, particularly on Long Island, inside and out, and has really been a great advocate for ensuring that we have fair coverage. So that's what she's going to talk about. She's got a lot of great resources with her organization, small not-for-profits. She's got a great message on how you can work with media, who you should be working with, some tips and whatnot. And so I'll leave it at that. And she's known throughout the world, by the way, as a media scholar. So, and we share a common friend, Ellen Frasina.
Oh, yes. Ellen was one of my college professors.
Yes, she's one of your college professors. And she, when I worked for her at South Oaks Hospital many years ago, I was her assistant director of community relations. Yes.
It is a very small world.
It's so small, isn't it? I know she's very proud of you. She's always telling me that.
I appreciate that. And I greatly appreciate being here this morning with you folks. I am trying to get a screen share going here. So I just have a few screens to show you. Janine, I think you want me to talk for about half an hour?
Yeah, about 15 minutes or so. Then I'm sure there'll be a lot of questions.
Okay. No, that's great. I look forward to answering questions. And honestly, even to talk for 15 minutes, I know your attention span is between 5 to 7 minutes. So I know I can be talking, but that doesn't mean you're listening to me. All right. So to be fair to both of us, let's mix it up to make sure it's engaging. All right.
Sure.
I do appreciate the kind introduction Janine gave us, and I'll just tell you a little bit about the Fair Media Council. We are a 501c3 nonprofit organization, which a lot of people don't know. And our stated mission is to advocate for quality news and work to create a media savvy society. And that is something that is growing more and more in relevance as the media landscape continues to fragment and get more complicated. And probably the most important thing to know is that we work for the public. We work for you, not for the media. And really, we're working to protect your right to know. Our members are businesses and nonprofit organizations like the Nassau Suffolk Hospital Council. So we thank them for their support throughout the years to turn the organization into what it is now and to help us to continue to evolve. Because we are a media watchdog organization, it's important to note that news outlets are not allowed to be members of the organization, and we actually restrict any income from them so that we have a clear-cut path to studying the news media as well as commenting on it and letting you know how they're doing. So really, we're here to report to you, not to them. We're here to keep an eye on them for you. So that's really what we do. And we do have the claim to fame, if you will, as being one of the oldest, most successful media watchdogs in the country. And we're proud to be located on Long Island. So with that, let's see, oops. Advance to next screen. Okay, that just took me all the way to the end. Hang on, there's a little bit in between. So what I want to do really today is talk to you about, I'm sorry, here we go. My screen is bouncing around. All right. I want to talk to you as news consumers, so people that live and work on Long Island, and how your news is changing. But I also want to talk to you as people that work on Long Island and your role of advocates for healthcare and improving the health of Long Islanders and your ability to get your message out into the media. So I'm going to talk to you rather broadly, and I want you to ask questions along, both sides of the equation, whether it's as a news consumer or as someone working to promote your own organization and be heard, both of which are equally important. So to begin with, I want to give a broad overview, and then we'll talk about some of the changes that are happening that you need to know. And we'll answer any questions along the way. Okay, so I guess you should feel free to use the chat. If you have any questions at any time, just feel free to shoot them at me. One of the things that we like to talk about is people who live on Long Island and grew up on Long Island have no appreciation for just how complicated the Long Island media landscape is. It's very fragmented, and our geography really poses some interesting challenges, especially to communicators. For people like you, you may want to have certain messages that you want to get out to people that live on Long Island. You may have messages that you want to get out to the greater New York metro area, and you may have messages you want to get out to Albany, right? Depending on what you're working on. All of that requires a lot of knowledge and a lot of understanding how technology is changing the news media and really fragmenting all of those audiences and making it very complicated to reach people. But also on the flip side of it, you can reach those people if you understand the setup of it. All right. And one of the reasons also that Long Island is sort of complicated and hard to get your handle on is we all know how the country settled from east to west, right? And that makes Long Island home to some of the oldest news media in the country. A lot of the weekly papers that we have date back to the 1700s. Some of them still operate like that. That's something to understand, that there is often a lot more news out there, but if you're just trying to do web searches, a lot of those places you're not going to find online, but they do exist. So that's one of the other things that's kind of interesting that's happening here. In terms of timeliness, this meeting couldn't be better planned, Janine, because we do have big changes coming to Newsday and News 12. Newsday just officially launched Newsday TV, which is an initiative they've been working on for a couple of years now. I'll talk to you about that. And News 12 continues to evolve and change, and I'll give you details about that later on. But basically all of this kind of encapsulates into understanding how Long Island's geography and today's fragmented media landscape really impacts audience reach and the way news outlets have added firewalls to their information also creates a different situation than we had 20 years ago. So it's been a very disruptive time in news media. And for communicators, you need to understand the challenges as well as the opportunities that these things present. Here we go. All right. So if I just want to break it down, I'll break down radio, television, and newspapers for you. So when it comes to local radio, Long Island is actually its own market. Nassau and Suffolk counties comprise the 20th largest radio market in the country, and that's out of 210 markets. We have on Long Island 18 commercial radio stations, and you have 2 NPR stations, and you have college radio stations. Okay, so NPR and those college radio stations are not commercial stations. Those are non-commercial stations. But people often don't realize how many radio stations that we do have that are at home here. Now, even though we have all those radio stations, that doesn't mean they're doing news. They may, however, be doing public affairs programming, or they may be doing some talk shows that provide avenues for you to explore and get your message out. So that's one part of it. Now, if we look at, here's just kind of a screen view of where all these radio stations are located. Now, this actually comes from the Fair Media Council has a media guide and directory online for people. it's restricted for members, but this is a screenshot from it. And what you can see is we use data visualization so that people can get a handle on where these things are, because lots of people don't know where things are on Long Island. You know, if you're in Nassau, you don't know where things are in Suffolk. People on the east end of Suffolk want nothing to do with Western Suffolk or Nassau County. There's a whole lot of different things that go on there. But this is just to give you an aerial view of where these guys are located. You know, you are able to click inside these little circles and different icons so that you could see the contact information for these folks if you were actually online looking at this. But just to give you an understanding and a visual of just how many outlets are out there in terms of radio. Okay, and then we go to local television, which is also completely different than the radio setup. So in terms of radio, Long Island is its own market, but when it comes to television, we're actually part of the New York City market. So from New York through Long Island, that's all considered one market. Lots of times people who don't know that think that we're in the shadow of the New York market, not understanding that when it comes to television, we are actually part of it, okay? But because of its audience reach, which is very different than what local radio will give you, it's very important to understand how the audience impacts how you need to pitch these people and the kind of stories that they would be interested in. And one of the things to note about television news in general when it comes to local news is our local television stations, and that what I'm considering the local stations is CBS 2, NBC 4, Fox 5, ABC 7, WPIX. These stations have all added hours of local news to their lineup. So that means you have more opportunities than ever to get your news out onto these stations. But you'll also need to understand the audience reach. And this will give you, this was actually pulled, I believe, from NBC to show you the audience reach of, if you get your message on NBC 4, these are the people that are exposed to that message. So it's not just Long Island. So you need to pick and choose which stories you want to tell that would also be of interest to areas of New Jersey, the city, Connecticut, things of that sort. So what we do as part of our media guide is not only provide you with the information of the reporters and how to contact them, but also a look at the audiences that they reach to help you formulate your messages. Okay, and the newspapers are totally different than radio or television. There is no particular market. Newspapers are just always measured by their circulation numbers. So if we look at Long Island in terms of Nassau and Suffolk counties, we actually have about 168 printed newspapers on Long Island. Those are your small weekly newspapers that we take for granted on Long Island. But if I were to look across the country, you know, there are about 200 communities in New Jersey that have nothing like this. They're now getting startup organizations that are providing online news, but they have nowhere near the amount of news coverage that these communities offer on Long Island. And that's not to say it's enough news coverage, but it's to let you know that it does exist, for one, and that these are resources for you to take advantage of. And as I said before, some of these weeklies date back to the 1700s. So some of them don't have a web presence. Some of them may not have a very sophisticated web presence. And some of them are actually very good at being digital forward. But what has happened most importantly, when it comes to newspapers and newspaper coverage, is the firewall that they've added, so that you need to have a subscription so that you can access the information. But what that also means for you in terms of being a communicator and an advocate for your own cause is that if you get news coverage inside these newspapers that have firewalls, it's very difficult for you to share that information with people who don't have subscriptions. So from a communicator's point of view, what you want to do is kind of come up with a mix of newspapers that are free, as well as the subscription base, because it's those free news outlets where you can share that information across borders and to people that don't necessarily have a subscription. And that's something people often overlook. Okay, and this is just a view of, on Long Island, reporters that cover specific geographies. So often you will find people don't know who their town reporter is or their village reporter. A lot of the stories that you may have may be very local, and the people that you need to start contacting from the ground up would be starting with your very local reporters. So this just gives you an overview look of how communities are covered. And you can see more of the dots exist in Nassau County, and that would be because it's more populated in Nassau. So the dots become a little more sparse as you go further out on the east end, but again, less population. One of the things people often overlook when it comes to news coverage also is news outlets measure how important news is by the amount of people that are impacted by the news. And that's something also that's important for you to know when you're pitching stories. Okay, and some of the issues that we deal with now that we see happening, and this would impact you, this first one, if you have children, but also if you're doing hiring, if you're hiring communicators in your office and you're hiring younger people. It's been over 20 years now that people have grown accustomed to the news finding them, which is to say, you know, you can go onto Facebook or you could go to Twitter and all of the news kind of converges and you can see the headlines and you can see the stories of the day. Way back when, those of us who are ancient, remember when you actually had to pick up a newspaper or you had to turn on the news at 5 o'clock or whatever to actually find out what's going on, okay? We're generations away from that scenario. So today's younger folks, if you look at younger millennials and younger than that, they don't actually know where these news sources are coming from. So they wouldn't necessarily know how to pick up a local newspaper or even who their local news is, because they just see it coming across their screen and all are equal. You know, if you look at any of the news aggregators out there, although aggravators is probably also a good term for them. I mean, you will see CBS Evening News right next to a patch article, right next to, you know, an ad. And that's what the younger generation grew up looking at. So they have no real way of distinguishing between, you know, what is news that you would view as news from an older perspective versus, you know, what's an ad, what's an advertorial, and what's an infomercial, which is a lot of what is masquerading as news today, especially on TikTok, right? So it's very interesting how technology has changed the way people not only get their news, but also has limited their ability to distinguish between what's news and what's not, okay? One of the factors that is a huge factor there is every time technology changes, it changes your news and information. It not only changes how it's delivered, it changes how it's presented, and it also changes the way you think, okay? We're now so far into the digital age that there's information out there that shows that, you know, our attention spans have declined. It's not because you're having a senior moment anymore. It's just because you've been online too much. You know, so some of the ways that we kind of communicate that is, we'll ask you, you know, if you watched television yesterday, do you remember any of the commercials that you saw? Did you see any commercials? Lots of times people can't remember what they watched or read yesterday. That's one of the symptoms of living in this digital age is you don't remember anything. And that's one of the key things to remember as a communicator. When you're trying to get your message out, you may feel like you talk the same message endlessly, but you need to remember no one's remembering what you're telling them. And that's why the repetition is so important, and understanding the fragmentation of the landscape so that you can continue to get the message out multiple ways. And all of this is also leading up to the fact that since technology changes so fast, The flip side of that is our education system changes very slowly, right? So there's always a huge gap between where technology is and your tech skills versus what's being taught in whether it's, K through 12 or college, because it takes a long time for a syllabus and for whatever is being taught to be approved before it's handed down to the students and then it's taught. There's a great big lag. And now what we see coming at us is immersive, as well as artificial intelligence, virtual reality. These things are starting to enter into the news stream where proper news outlets, whether it's the New York Times or, CBS News, they're working with immersive technologies so that you can start experiencing news that makes you feel like you're there. The flip side of this is, where fake news became a thing and something to be concerned about. It's one thing to read fake news or watch fake news. It will be another thing where they'll be using virtual reality so that you will experience fake news and not know what's real anymore. And that will be something that will have a huge impact on mental health going forward. But that is what is fastly coming down the pike these days. And again, far faster than our education system will allow for people to fully understand the impact of. And of course, if you're in a position where using media relations as a tool for your organization, it means that your need for constant training and an updating of skill sets needs to be ongoing because things keep fragmenting. So audiences keep changing. The way news outlets are using your information. There used to be a time, not too long ago, where you would write a press release and put it in an envelope and stamp it and send it off to the news outlets. And now they expect things sent not only instantaneously, but they want video and they want audio with it so that they can use it in a multiple of ways. So if you're not able to give them all of that, you're actually shortchanging your organization. And one of the other things that has also changed is, for a long time, organizations viewed communications as a soft skill. Because of the way technology has changed, a lot of what you do now, you can quantify, you can show results. So it's kind of moving into a hard skill so that the good news is if you're doing these jobs, you can actually outline goals and you can actually show progress. Where for a long time, people in communication roles weren't really able to do that. They could say, okay, I produced a brochure, or I created a Twitter account and we have 20 more followers than we had a month ago. Those are all tactics. They're not necessarily achievements. They're not necessarily representative of impact of your organization. Now everyone wants to see impact. So the good news is if you are up to date on your skill sets, you are able to show impact in the way that people want to see it and to show not only to illustrate the breadth and scope of your work of an organization, but also of the team that you have working in communications. And of course, as all of these things change, if you're involved in a budget, you need to start looking at the budget a little differently. Because 20 years ago, you didn't need a subscription to look at news online. Now you do. In-person events are something that on Long Island in particular have long been relied upon as ways for people to connect and network and get their message out. So if if your budget in the past didn't include tickets, that is something you should consider as part of your communication package as a different way to get your message out. So all of these things, as technology changes, it's really changing the landscape for you as communicators. And, the good news is you can get your message out and heard in many different ways. The bad news is it's a lot of work. It's a lot of constantly trying to find out what's new and what's happening and how you can be a part of it. but it can be done. And I think with that, and just in terms of overview, I'd like to start taking questions if you have any.
Do we have any questions around the room? I mean, yes, go ahead.
Hi. I don't know, can you hear me, Jackie? Okay, so one of the questions that I had, when you mentioned that Long Island is included in the media market for New York City. So one of the challenges that we've faced is that sometimes reporters don't want to come out and do that distance for like an in-person interview or different things like that. And then I was also interested in you elaborating a little bit on immersive technology and how that impacts mental health. I happen to work at the Association for Mental Health and Wellness. We're friends on Facebook. I haven't seen you in person in a long time, but I'm very excited to hear about your presentation and know a little bit more so that we can advocate on including something like this in our budget. So yeah, those were my two questions.
Okay, no, those are great questions. And I know just in terms of television coverage, lots of times people can't get News 12 to come out because they only have one truck kind of a thing. So part of it is, yeah, understanding the logistics of it. You know, that it used to be sort of a kind of conventional wisdom. People would say, if you're anywhere farther than, 110, it's going to be very hard to get a television news truck out to you because it's so far from the city. The good news there is you can use technology. If they can't come out to you, there's nothing to stop you from doing something online with them. To see people being interviewed online using Zoom is happening in all news media today, even, major news productions like 60 Minutes. It's not uncommon to see it. The other thing you can do is, prepare video for them so that you have it and you can say, this is what we have. Let me give it to you. They may edit it differently, but if you can provide them with the footage that is an excuse for them not to have to come out, then you're a step ahead of the game. Does that make sense to you?
Absolutely. And I just, the comment that you made, I was intrigued on the comment that you made about immersive technology with news and how that will impact mental health.
Yeah, because really what we're seeing, I mean, when these things are developed, technologists will tell you they only have the best intentions in mind. Okay, so but it takes real people like us to figure out how to use it for deviant purposes. So one of the things that's happening is, let's see, a few years ago, as a matter of fact, the New York Times has done a few stories where you're used to seeing print, but then suddenly they'll show you video that takes you kind of inside the scenes. And that is meant to enhance a story, to be able to give you more detail, really to bring the story to life. Now, if you use that for good purposes, shall we say, that actually expands your knowledge. It gives you a better understanding of history and culture and all these kind of nuances that go with the story. But in the hands of the wrong people, they can be using these same skills and technologies to create stories that don't exist. And now, if it doesn't exist, but you've actually wandered into it, it's almost like a video game is happening. There's so much confusion these days in the news, particularly with the political landscape these days, right? You've got hardcore people on both sides of the aisle talking about this happened, and then you've got people on the other side of the aisle saying, no, that didn't happen. Well, it's one thing to hear them arguing about it, and you have to decide, but it'll be another thing for you to actually see video of something happening. And the video doesn't even need to be true. I mean, we're all sophisticated enough to know that you can edit a video to make it look like something happened that didn't, right? It's very easy to take something out of context. You can edit a quote out of context. But now what we're talking about is using, the latest forms of technology to not only alter the message, but to alter the entire story, so that instead of just reading stuff that isn't true, you'll be actually inside of it and feeling as if it happened. And the challenge there is going to be, if you see something along those lines and I see the opposite, we can argue forever over which one of us is right, right? So that's really the caveat that's happening, and the real danger that we need to keep an eye on, especially for younger people who don't know the difference. They're used to video games, they're used to the immersive, they're used to virtual reality, but those are games. So there's a difference between the games and real life. One of the basic tips that we give out is you never want to rely on one media outlet for your news. You always want to mix that up, and you want to get your news from a variety of media outlets. So you want to get local news, you want to get regional news, you want to get national news, you want to get international news. And that's kind of a way to structure a media diet. And if you see something or read something that seems sometimes you just have a gut instinct that something isn't right, you want to go to other media outlets to see what they're saying about it. And that's one way to protect yourself. But the reality is, technology can be very convincing. And if you don't know how to use it, and if you're not used to it, it's younger generations and older generations that become the most susceptible. So if you're using high-tech ways of getting your message out, you want to be one of the good guys, right? And you always want to be responsive. So where we are with using immersive and artificial intelligence in terms of news right now, artificial intelligence, actually, news outlets have been using for well over 10 years. It actually started with them using AI for sports reporting. The idea being that, someone wins a game, someone loses a game. Why do you need a person to cover that? Okay. But anyone who is a sports fan knows there's much more that goes into sports than that, right? So they started very slowly with the artificial intelligence. And really the idea there is that they use it to help them with what we would consider like the low-hanging fruit. Okay, maybe, typical facts it can pull together for you, but you can't rely on it for the reporting in totality. All right, I see we have a question here. Do you have a hand up?
Yep, we do.
Okay.
Joseph Sarno.
Hi. So this is a great presentation, and I think you articulated this just a minute ago. I was going to make a comment, but this also affects older generations. Yeah. Instead of targeting or calling out younger folks that this has been affecting, it also affects older folks as well, older generations. I'm a millennial, older millennial, I'm 40. So I have perspectives of both. I grew up with limited technology and then technology exploding. So I can navigate and see what's real and what's fake. And sometimes it's hard to do that. But with older generations that didn't grow up with technology, with computers, and then all of a sudden it's just going so quick that it's hard for them to navigate, that they can be easily manipulated.
It is a hard word to say. I avoid that.
I can't believe I just screwed up that word. But yes, you don't understand what I'm saying. So yeah. So I just wanted to put that out there. That
no, I mean,
it affects both sides.
No, it's true. And you don't even have to be that old. I mean, every time you get a new phone, I mean, I'm cranky for 3 days because I don't know how to use it. And I don't think I'm that old. And I think I have pretty good technology skills. But, all of us kind of come at it from a different way. But, when we started saying we work toward a media savvy society, we did that 20 years ago before all these things exploded. So in one way, it was fortuitous for us to build this into our mission to help educate people on these issues. But honestly, we had no way of knowing that, the way the media landscape has evolved is what we would have, presented to us today. And I can tell you one of the areas that technologists are also working on is the idea that the doctor of the future will be an avatar. And the idea is that they can program the avatar to contain all of this medical knowledge, which will be much more vast than a human person would have. So I leave it to you in the health industry to decide whether or not that is a good thing or a bad thing. But that is one of the ideas happening out there.
There's a comment in the chat. Is there any kind of labeling or statement to allow a reader to know its true experience versus fake news, game versus real life?
No, as a matter of fact, there's not even any kind of standard when it comes to labeling news between this is a news article and this is opinion.
Right.
Okay. And that's honestly probably one of the biggest issues that the news has continuously faced throughout the years. As we know from research that 70% of the American public can't distinguish between fact and opinion, which makes today's media landscape incredibly hard to navigate to begin with. And then to throw in, well, this may be real, this may not be real. It's just a huge issue that's evolving. But what's interesting though, is if you go to a movie, a movie has a rating, right? So you know what to expect. And you know if that movie is something you want your kids to see or not based on the rating. But yet our news outlets can't come up with some sort of uniform rating system. And honestly, they should, just to be able to guide you as news consumers through it to say, okay, this is what you should expect in this next, whatever it is you're clicking on or viewing. But that's where they're at with it. And
a follow-up question to that is how can we change that? I know, it's like,
well, how you can change it is really one, talking about the need to educate people about the media landscape, because for a long time people just assume, oh, it's news, or whatever my fourth grade teacher told me about newspapers is what I go on. My fourth grade teacher told me life is fair. Okay, things change. We also have a very limited understanding of the First Amendment in the country, and the way news and technology has changed, everyone is employing the First Amendment and using it as an excuse. Okay, the First Amendment does give you freedom of speech, but it also makes you responsible for what you say. That part of the amendment is usually left out.
That's right.
If I really want to get, into a very strict definition of the First Amendment, the amendment is there to protect you from government censorship. It doesn't say anything about businesses censoring you. It's why businesses can tell you what you can wear when you enter the door. It's why they can tell you what you can and can't say or access during work hours. So the First Amendment itself is something we need to be better at educating people about.
There's a question from a hand raised from Dorothy.
Okay.
Yes. I know you was talking and you was saying living in the digital age that everything should be kind of like repetitious. So how much is too much repetition? You know what I mean? Because I know you're trying to keep communicating with whomever you are. So would that pose like, it's overwhelming or something, or it's a balance?
Well, it depends on, well, one, how do you define your audience? Lots of times people actually have different audiences, but they consider it one. So you may have an audience that is, if you're a doctor, you may have patients. That's one audience. If you're part of a healthcare collaborative, you have your colleagues. That's another audience. If you're a publicly held company and you have investors and stakeholders, those are different audiences. Okay. So for all of those different audiences, your message needs to be changed to accommodate them. And where that message is placed needs to be placed where they're looking, not just what's convenient to you.
Correct.
So, and you know, the issue today is because the media landscape keeps fragmenting. You know, the big thing today is everybody wants to be a news outlet, and they keep sprouting up, but they all have very limited audiences. So, you know, very specific niches are out there. You know, and in the past where you can rely on, you know, even a major newspaper where, you know, the New York Times, you would say, okay, if we're in the New York Times, that's at least 1 million people reading and watching and, you know, getting my message. It's not like that anymore. Now, how many people actually have those subscriptions? And it breaks down from there. So a lot of it is really targeting the message and then targeting where it needs to go. Like I can give you an easy example, which is Long Islanders like to think that, you know, the world is based on Long Island and there's nothing beyond Long Island. Okay. We like to say, you know, we need to get this message out to Long Islanders.
Correct.
All right. So if I'm peddling a Long Island story, okay, that's a great fit for Newsday or News 12 because they cover all of Long Island. But if I want to take that story to something like huntingtonnow.com, which covers Huntington, they're going to tell me they're not interested in that story because it's not particular to Huntington. So for their purposes, a Long Island story is way too big. Okay. But if I go to one of the New York City television stations with that same Long Island story, they're going to tell me that story is way too small. Okay. Because out of any of the television stations, their audience base is about 20% of Long Island.
Okay.
Or 20% of Long Island comprises their audience base. It's not just 20% of Long Islanders watching it. It's the fact that it's viewed in New Jersey and Connecticut and New York City that, you know, out of all the millions of people watching, 80% of them aren't going to care about a Long Island specific story because they're not on Long Island. So you take that same story and you say, okay, well, maybe it's a great human interest story. Or maybe I've got a great trend story, you know, so you can't pitch it as a Long Island story. Right. So that doesn't work for, you know, outlets that are national or regional.
Okay.
It'll work for, you know, the big ones on Long Island, but it won't work for the small ones on Long Island. So it's kind of like, you remember that story? Was it the Three Bears or the one where, you know, Papa Bear sat in the big chair and the chair was too big? You remember that children's story? I don't remember which story it was, but which one is it?
Goldilocks and the Three Bears, right?
There you go. Okay. That's what story pitching kind of comes down to. You need to make sure the pitch matches, you know, whatever outlet that you're going to.
Okay.
And this has become more important over the years because of how everything is fragmented.
So you,
I'm sorry, go ahead.
so you're saying that, you know, once you target the audience, that same story, all you have to do is keep your audience in mind.
Yes, exactly.
Okay, thank you.
Exactly. Because what people like to do is they like to make one press release and send it everywhere.
Right.
Okay. I can tell you, inside newsrooms, that makes news people grumpy. And they will peg you as, you know, the organization that doesn't know what they're doing. Okay. So it's important to, you know, protect your own reputation.
Correct.
As well as not waste other people's time, right?
There's a lot of detail and there's an art and a science, right, to pitching news, and
definitely,
you know, it takes time, and a lot of people who work in media relations, they have superiors that don't understand that, right? So just one press release is not going to cut it across the board. You do have to put at least the lead, you know, change the lead so the lead will grab the attention of and speak to that particular news outlet. But I wonder if we might just switch for a moment and comment on social media. I know you're not really, this really doesn't fall under your purview, but sort of does. Only because so many not-for-profit, small organizations rely on that, right? Because it's free and we can get our message out. But there are so many limitations to that I don't think people realize how many followers you might have, how compelling is the message. You really need to use visuals. You can't, and if you use visuals, you can't use very busy visuals. So maybe, I think a lot of people fall into the trap of thinking if I just send it out on social media, I'm covered.
Yeah, no, and the thing is, social media has been around so long now that we're starting to see, surveys and actual research. When it started, it was true, okay, this is an easy, free way to get your message out, but it's also gotten very sophisticated very fast. So you really do need to be a professional now to be effective at those postings. You need to have, video and audio skills, and you need to understand that, in that kind of setting, if you can't grab the person's attention and sell your whole story within 5 seconds, you're wasting your time. Okay, not a lot of people can do that.
Yeah, it's a skill.
It truly is a skill set. So I know a lot of organizations, they often have their media relations person also doing the social media. That's a huge amount of work for anybody. And it requires a lot of different skill sets. Some organizations have their media relations person is also their HR person, but all of these things are so evolving into very separate types of jobs with different skill sets. Honestly, I don't find social media for what we do effective at all. We've found that LinkedIn is really where we belong in terms of an organization. We don't go out on Twitter because we don't regard it as a credible place for information. We do share things on Facebook, but if I'm looking for, say, ticket sales or members or things of that sort, the way I see social media and how it's evolved, if you're selling something that isn't like a $20 set of sheets or a $15 miracle cream, I mean, that's the sweet spot for selling stuff on social media. If you're really looking for credibility and selling something of value, you'll have limited success there.
Yeah, I just thought I would.
I have a question.
Sure. Go ahead.
Hello, I'm very curious to know about the trainings that the not-for-profits or different organizations should be, because you mentioned earlier about ongoing trainings. What would these trainings be or look like?
Oh, okay. Well, we do offer some. I mean, we're not the only organization that does communication training, but we will do things that will help you with pitching, helping you understand the media landscape, as well as really our hallmark is bringing out the news media so that you can meet them and start building relationships. Because really, from our perspective, that relationship building is the most crucial thing you can do to helping get your stories out, because it's the relationship that gets, a news reporter to call you to say, you know what, it's a really slow news day. You got something for me? That doesn't happen if you don't have a working relationship.
And it's time. That's time consuming, labor intensive. Yeah.
We do monthly communication workshops. So we have one coming up in April that'll be on building a social media campaign. But then we have one coming up in May that'll be on media relations itself. So we define communication skills pretty broadly. And then in the summer, in July, we do a half-day communications boot camp. That covers a range of things. We're actually working on that agenda for this year, so I don't have it set yet, but it'll be kind of a cross-section of things that we discussed, but bringing in other people so that they can share tips and resources with you of ways to better communicate your messages. And we're looking at maybe making it a little more interactive, where we give you a scenario and we see what kind of plan you will come up with, And we're going to actually do that at the Nature and Energy Center at Jones Beach. So if it's a nice day, we'll start with the beach walk and incorporate some of those outdoor things that we miss by working too hard. But we also do, we have a YouTube channel that you can take a look at some of our prior programming. I mean, that's all free. Our YouTube channel is Fair Media Council-FMC. Some of our workshops are up there, as well as some other programming that we've done. And we also do a weekly newsletter that comes out where we do commentary on news and local things that are going on, as well as regional and national. So if you want to sign up for the newsletter, that too is free. You can do that. You can find the sign up on our website.
And you have a great blog too. Your blog.
All of that will come from the newsletter. So if you take a look at that, you can follow different ways and see what you're interested in. And of course, you can always email me if you have any particular questions or ideas or concerns about something. There was one thing I meant to say and I forgot my train of thought. Do we have any other questions?
We do. Over here, we have a couple.
So I kind of have two questions, but one of the questions that I think is most important is when we do want to put our messaging out and we do want it to be repetitive, like, do you have any pointers on how to make it stand out from all the noise that is surrounding them, you know, before and after? Because you, like you said, people have a short attention span and they may not remember the message. So, or is there like a better time of day where the message should be presented to the public?
Yeah, and there is, and it all depends on which channel you're using. And that information actually is very easy to find. I mean, I know like typically on YouTube, I think it used to be like Monday and Thursday afternoons were the best time to be seen. But these things also change very quickly. So it's the kind of thing you just need to do a little research. You can Google, you know, best time to post to whatever outlet, that sort of thing. When it comes to the news media themselves, we do have some tips included in our media guide as to like when the television news reporters prefer to be contacted and how to contact them, things of that sort. The way it filters down is the more you do it, you'll see the more personalized things become. So one reporter will prefer it this way, another reporter will prefer something else. So if I was in your position, you know, I would really look to establish, say, 5 good contacts with the news media, you know, and that would begin with wherever your office is, whatever the local news outlet is covering that area. Start there. Start establishing relationships with your very local folks. That helps you start to understand kind of the groove and what they do for a living. It also allows you, though, a little bit of an insurance policy, because if you get something in the news and it turns out to be wrong, you know, better it be in a small outlet than a huge outlet, right? So you kind of think of it as a kind of a little practice session. And you also don't want to discount a news outlet simply because it's smaller than another one. The same thing with the social media channel. It's all about effectiveness, right? So Long Island Business News targets business executives. So it has a much smaller audience reach than Newsday does, but it's key people. Mm-hmm. All right. So you really want to pay attention to who the audience is of the news outlet that you're trying to reach. Usually people are so busy trying to push out a message, they don't think about the other half of it, which is who's receiving it. Mm-hmm. And the other thing for people in your position is lots of times what happens is there are major news stories that are out there that you can become part of. So you can there are 2 ways to do news coverage. You can be proactive, which is pitching stories and getting out there, or you could be reactive, which is providing opinion and commentary on things that are already in the news. So the other day, of course, we had yet another gun shooting, you know. If guns and gun violence falls under your area of expertise, like Northwell Health has their Center for the Prevention of Gun Violence. When a story like that breaks, that's a great time to, let news reporters know that you have an expert available for comment, but you can also provide written commentary or video commentary to news outlets to speak out on these issues. And that's really a great way to get news coverage that people seldom think about, but you need to be reactive and you need to be very quick about it so that you're part of that news cycle.
Right. Do you have another question?
I did. Did you?
Oh, yeah, I didn't want to. Okay. So my other question is, since in the Suffolk County Department of Health, we have a lot of programs with a lot of stakeholders, and so they use different types of media to get information out to the residents. One thing that we are trying to capture is some of the data or the impact of the information being, delivered to these residents. Do you have like any pointers? Because I'm not sure if it's good to look at like numbers of clicks or numbers of views or numbers of followers. I'm not sure what would be the best way to collect data on people getting that information.
Okay. Well, I don't think there's, any one way that is right or wrong when it comes to that. But from my perspective, if I'm looking at it strictly in terms of a communication vehicle and how effective it is, if it's something online, the whole premise of online is not that I'm talking at you, but I'm talking with you so that you can provide me with feedback. So you need to have that feedback channel built in so that you can get reaction from people and solicit their opinion. The classic communication model is not I talk and you listen. It's I talk, you listen, and then you respond to me. And that model's in place because if I'm talking to you and I'm speaking Greek and you don't understand Greek, you're not communicating, even though you think you are, right? So you always want to build in some sort of feedback channel into anything that you do. Lots of times people, they don't want to comment on something publicly. So if you're putting content out there, you want to make sure that there's information on how do they reach you? How can they easily provide you with feedback? If you're doing a hard copy mailing, I would suggest you at some point include a survey, with the postage paid envelope, if you're expecting them to respond to you. If you can't give them an online version of that, anytime you do surveys, you don't get a great response. You might want to do the dollar in the envelope. That is, the way the car dealers do it. Or a raffle prize or something. So you need to give them some kind of incentive to respond to you, but you should always be looking for feedback.
You got a question?
I
I think
did.
we'll take one more question because Jackie, we
Oh,
kept way over time.
no, I'm fine. I'm here for whatever you need me to do.
I mean,
Janine.
I think the group here would just listen to you for the next half hour.
Exactly.
Yeah.
Exactly.
Well, if I'm helpful, I appreciate it. If you want me to shut up, tell me that too.
So, but we do have a few other items to get through, but I don't know how quickly we can do it, but this conversation is, and what we're learning here, I think is invaluable. And
Yes.
it's something that is not often talked about.
Yeah. Yeah, and that's, and thank you, but that's honestly why I like to give the overview of, just our setup for media coverage here, because Long Island is very different than other places in the country.
You had a question.
I do. The communication workshops, are they offered for free or is there a cost?
The ones that we do monthly are included with our membership. So if you were a member, they're free. And we do membership by organization. So, we don't put a limit on just one person from an organization.
And if I recall, I think the not-for-profit membership is pretty reasonable.
They're designed so that they're scaled by number of people.
Number of people.
So smaller organizations pay less, obviously, and they're divided between corporate and nonprofit. I should know the rates. I don't. They are online, but if someone wants to email me, I'm happy to send them the information on that. So the monthly workshops are included in membership, but things like the boot camp, those are things that we would sell tickets to and anyone can come to. And for when we sell tickets, then members get a discounted ticket price.
Thank you.
Does
And
that
then-
answer? Okay.
Yes. Yeah.
Any other questions? Any questions online?
Nothing in the chat.
Nothing in the chat?
Can we give you feedback or can I ask one more question?
Sure.
So we cover such a large territory. It's hard to like your idea about the 5 good contacts and work locally because we cover from, Long Island to Poughkeepsie. So it's such a big, amount of space.
Yeah.
Is there a tip that you have on becoming a resource? Like frequently we'll see an article about organ donation and half the information is incorrect. And yet they don't even know how the process works and don't know who to go to get that kind of information. So is there a way to build relationships with the reporters that when some topic like that comes up, we can be seen as a resource?
Yeah, sure. Basically, what I'd suggest doing is starting out by simply Googling news articles on the topic that is in your area of expertise and saying who the reporters are that wrote those news articles. Some organizations have it set up where they have beat reporters that cover only those topics, and some are general assignment. So general assignment reporters are harder to pin down because they tend to focus on breaking news, or today they do a health story, tomorrow they do a finance story. I would suggest you find some beat reporters and start building relationships with them. And often it's as simple as sending an email, a letter, or a phone call, just introducing yourself and saying, we'd love to be a resource for you in the future. This is our area of expertise. Follow up with that. I mean, sometimes, if it's someone that, say it's the local reporter in the community where your headquarters is, they're often most amenable to getting together. We'd love to give you a tour, things of that sort, maybe grab a cup of coffee. It used to be lunch. They always liked free food, but they don't have that kind of time anymore. But there's nothing to prevent you from doing that kind of outreach. So don't be shy about that. What you don't want to do is just send a random reporter that you've never spoken with, criticism of the article they just wrote, because that's not the way, a healthy relationship starts out, right?
Right.
What you can do is you can write a letter to the editor saying, there's a lot of common misconceptions about such and such, and we'd like to offer the following information. Okay, so that way you are correcting the information, but you're not calling someone out on it.
What I've done, Jackie, to answer to that, if there is an article that appeared and it is in your area of expertise, I've actually reached out to the reporter and said, oh, I saw the article, and I'm not negative in any way. I say, you provided some really good information. Did you know my organization is such and such, and we'd be happy to expand upon if you're thinking of writing something else as a follow-up. And I've done that, and I've had a lot of success doing that.
Okay, great. Thank you.
But don't, like she said, don't be negative, because then you're done.
Yeah.
Done. Yeah.
Well, no one likes that phone call, right? You get that crazy person screaming.
Hi, how are you? You're wrong.
Exactly.
So, yeah, you want to start out by building healthy relationships. Once you have that relationship established, then you can start going into, well, I know you said this, but, I have a different point of view on that. Or you said this, but you know what, those facts are kind of out of date, or that's old science. Let me give you the new stuff. So in a way, you're gently nudging. I mean, there are times where we will step in when we know something is wrong. to get it corrected. Like, with the pandemic, there was a lot of coverage of the pandemic by reporters who don't know anything about covering pandemics, right? Because it's been a long time since we had a pandemic. So there was a lot of misinformation out there. And, we would reach out when it came across our desks to say, listen, here's what we got. Your editors need to see this. And that they would take. But we do it behind the scenes. And even though I do that, I don't then send out a press release saying, look, X media outlet got this all wrong. We had to correct it for them, right? Because they're not gonna take anything we give them going forward. So it's a matter of knowing the way it works, and sending out a press release saying I accomplished something is great for me and my ego, but I would much rather serve the public by being able to do that continuously, so that you have the right information, than me, taking a grandstand and a bow once in my life. So, you do what you do the best that you can, and understand that, if your goal is reached, then congratulations on reaching your goal. You did it. You did your job, you did it well. And the public benefits from that. And you guys do that kind of work every day. So I congratulate you on that, and for all that you do throughout the year to keep us healthy and happy, and, just being able to produce. Because I think lots of organizations are overlooked and their stories aren't being told about the good that they do. So we need you to keep, pressing forward and peddling your message and getting it out there.
Okay, so with that, I think we're gonna let Jackie go. If
No,
everybody's
no,
okay with that. She's got an email up there. If you have questions, certainly feel free to email her. I highly recommend that you look, perhaps joining the Fair Media Council, because it's a great resource. There's that great media guide, which is worth its weight in gold. And Jackie is very, very well respected among all media.
Thank you. No, thank you for all the time. I appreciate it. Good luck with everything.
Thank you so much, Jackie. She's amazing. She's
Yes.
so good. Isn't she good? She's really, really good. So I just thought that would be helpful for everyone, because there's so many diverse organizations involved, not only in the collaborative, but even outside the collaborative. And many of your initiatives overlap, or you could kind of be competitors in some way, right? So learning how to make the best use of the media resources that are out there really benefits everyone, because ultimately we want to improve the health of Long Islanders. That's the collective goal. So, and I thought a little session like this would be helpful, because we've never done anything like that. All right, so it's getting late, right? So everybody probably wants to get out of here. So we'll just go over the rest of the presentation here. Again, I left on the table out there a prime example of collaboration, a multi-sector collaboration that occurred. It had its genesis here at the collaborative back in January of 2017, believe it or not, when I distributed a health affairs article to everyone about, it was called Beyond Books, and how libraries in the Philadelphia system were becoming more and more resources for those who were seeking social supports and health services. And so it was a study, and Stony Brook University said, gee, this would be something our public health students could get involved with, and then Adelphi University got involved. And so the two universities, over 50-something libraries, public libraries, who agreed to go through the interview process, and the collaborative. We funded some of that when we were still under state funding. And lo and behold, this many years later, the results of the study were published just this past January. So that's a really good feather in the cap for everyone who works. And we're happy to do like research projects like this with anyone, right? Feather in the cap for those who worked on this. What this research found dovetails with what we found in our recent 2022 Community Health Assessment Survey results, like mental health, like shot to the top, no surprise, right? So that's there, and we just wanted to let everybody know about that. What's next?
Thank you.
The clusters, okay? So if you were here at last, no, was it December we met?
December.
Years ago, before the pandemic, in the before time, we had some small subgroups that were working independently under our direction at the collaborative on a variety of issues and topics, so that the idea was different organizations, so let's take mental health, let's like take adult mental health, different organizations that are working in that space, whether it's the Association for Mental Health and Wellness and their Nassau counterpart, maybe it's a hospital, maybe it's an organization like Nadine's, right? They would say, yes, we're gonna be on this core cluster, which is really a work group, but I call it core cluster because I don't want you to think you have to do a lot of work. You try to do most of the work behind the scenes, but what we need is the expertise and the knowledge of the individuals who work in the field to come together in these core clusters. So they would come together and they would decide, maybe they decide, let's look at just a couple of zip codes that seem to have a very high incidence of depression and anxiety and even suicide attempts. And they focus on that, and then we help them, and they also, through their resources and expertise, pull together as much information we can, right? As much data as we can, right? So maybe we need to connect with the schools. We look at secondary data that's already out there, right? BRFIS data, for instance, and some of the data we collect, right, over the years here, that we can synthesize all that and process it. I often say we're information processors at the collaborative. We synthesize it, we process it, and then we know the problem exists. We know we don't have enough mental health providers. We know all that. So we come out with some kind of a product, whether it's a white paper or some kind of a issue statement. And then we say, well, what are we going to do with this? Well, that small group says, and again, start in small steps, right? So I say, perhaps instead of all Long Island, you just pick a few zip codes where it's a real problem. We come out with the statement or white paper, we've got data behind us. And now we say, we're going to bring this to, I don't know, to the school district, right? We're gonna go to, we're gonna get an appointment with the superintendent of these couple of schools, or this is just one example, you can't do this. Or we're going to go to the county, right? So the counties have Office of Mental Health, and we're gonna say, look, this is a real, we know there's a problem, this is a really stark problem in these couple of zip codes. Here's some data we have, maybe we even held a focus group, or we found research, right? About focus groups that might have been held, because right, we're doing this with no money, right? We have no money to do anything. So that becomes an action item. Now, small steps, is it going to change everything and make sure that everyone in those particular school districts have counseling and access to a social worker? No, not in the immediate, but perhaps in the long term. So when I talk about these core clusters, that's what I'm talking about, right? So, and then we do that. And then to Jackie's point, on the other half of that, we at the collaborative, because my background is in communications, media relations, as is Brooke, right? Also some population health and public health thrown in there somehow over the years. Now I'm gonna try and I'm gonna work my contacts and see if I can get something covered about this. And little by little by little. So that's my vision for the core clusters. And then you, the individuals who, 5 people on a core cluster, I would hope, feel good about an end work product that you now have, that you can bring back to your own organizations and that we can use to collectively do something on a larger scale, right? So then maybe we go to another group of zip codes, or maybe we decide, yes, we can look at all of Long Island. And that's what I was thinking. In the past, we've had a physical activity, we was trying to start a physical activity cluster. We had a food security, hunger, nutrition cluster, whereby we did look at one zip code. Oh, and it was in the Wyandanch area, right? So there's a lot of food deserts there. And we said, all the organizations that are working in that area, and there were a number of them, and they're on the call too. Let's see what data we can gather. Is SNAP being utilized? Who's eligible, right? And you can, this is public data, you can find this out. Those who meet the income eligibility for SNAP, what % of those in that community are signed up for SNAP? Okay, so that's, I think we found that many weren't, and they should have been. So now we can say to the organizations that enroll in SNAP, I think it's the Island Harvest and Catholic Charities and those kind of, you know, think about doing getting into that community, getting into the community center, speaking with the church leaders, you know, get something going to enroll these people in SNAP. We found that there was, of course, only one supermarket there, and we were trying to, and I remember it, and let me tell you, this took like a year's worth of time to just get this data. We wanted to see who was using the EBT, right? So who was using their benefits, who had it? And it was like 0. And we were like, how can this be? Well, after a lot of phone calling, reaching people at the state and looking on different websites and hunger solutions, different organizations, it turned out that that one food store, Compare Foods, I think it's called.
Yes.
Did not, the machine was broken and it never, the state never gave them a new one or fixed it or whatever they were supposed to do. So the time period we selected, 1 year to this year, we had, when we were like baffled, we're like, how could this be? Now that was very time consuming. So we were trying to plot all this and put it together in a report. We did a lot of asset mapping. So we had this one store, we had where there might have been a deli or a gas station that maybe sold some foods, right? So we put all this together, and then this pandemic struck. And so all that work kind of just stopped. The collaborative, which used to be the Population Health Improvement Program for the state, right? That was a 5-year program. That funding ended in 2020. And so now we were left with just me for a while, and then I got broke. Before that, I had more staff that could do more of this work. We've kept it together really because the infrastructure that we built is so important with 200 and something organizations, not all represented here, but that's about how many it is. We just said, we got to keep this going. And so that's what we've been doing. So now we feel it's time, perhaps we can resurrect those core clusters. And we did talk about it in December. We sent a survey around, which our intern Dorothy spearheaded. And we got some responses back, and I think you were going to kind of talk a little bit about some of the responses.
Sure. Yeah, so we've gotten 14 responses so
Which
far.
doesn't sound great, but 14's better than none, so.
And a group of 14 people, I mean, that could be pretty impactful. But so these are the top topics that have risen to the top so far. And a lot of people who have answered do seem to have a pretty common goal of, trying to move the needle, like Janine was saying, through these, collective impact interventions or campaigns or whatever it is that the groups choose to put into place. So the survey will be closing in 1 week.
So it's, so
Yeah.
please take it if you have it.
Please.
Yeah.
And the slides, of course, will be available to everyone. It'll be linked, and we'll send that in the meeting follow-up too.
Sure.
Are the core clusters just adult driven, or is it pediatric driven as well?
If there's a core cluster that you just want to be pediatric driven, that can be so, or it can be adult and pediatric.
There's an other option too
Yeah.
on the survey, so anything that's not there, feel
Yeah.
free to
For
bring
some
that.
reason, adult mental health, there was a distinction made, I really don't know why.
We also put youth mental health on
Oh.
the list to distinguish.
Yeah, which is a real problem. I mean, I would think youth would be popping up there because that's where it's really happening right now. But anyway, be that as it may, and it's interesting when you look at the first four, right? Except for maternal health, which is a very valid and important cluster to perhaps take a look at with the maternal mortality and morbidity that is experienced, particularly among communities of color, both on Long Island and really throughout the state and the country. But those first four of them, they align with the prevention agenda priorities that this group has selected, right? And that's going back to the state has a prevention agenda with 5 priority areas, and they ask hospitals and counties to select, in consultation with their community-based organizations with whom they work, 2 priority areas to work on for each of the 3-year prevention agenda cycles. And it is always rising to the top is reducing chronic disease. And what's the way to best manage or prevent the onset of chronic disease? Physical activity, proper nutrition, right? Maintaining a healthy weight. And then the other priority was looking at mental health issues and substance misuse issues. So it's very interesting that again, this all correlates. And to me personally, I find it very frustrating because we know these are the problems and we survey, and they keep showing up. And it's the solutions, Now that's another whole area to get into, funding for solutions, right? Public and private funding. Many organizations do have funding for different programs. It lasts a year or two, and then the funding goes away. Now we're back to square one. There's not enough investment in public health infrastructure, by no means. We saw that with the pandemic, but we can't solve all the problems. We can't. So if we kind of just look at it as in these clusters and maybe specific geographic areas or specific topics or disease occurrences or incidences, and then do some action steps that somehow try and make a difference. That's what the purpose of the core clusters is. So if you haven't responded to that, please do. And we will set up meetings to brainstorm, kind of like what I just said, all within reason, right? We have to understand, we all have our full-time jobs. That's where your first allegiance is. So I understand that. This collaborative is not all that I do. This is like maybe 25% of what I'm tasked with doing. So I understand those pressures, but I also understand how everything interconnects and intersects. And the one, whenever I run these meetings, or the whole purpose of the collaborative is that I want all these diverse partners, you have to feel you're getting something from this. And I think the core clusters, if you could work in these small groups, that would be a way to do that. And then, of course, still the quarterly meetings. So we'll be behind the scenes, providing as much support as we possibly can, setting up the Zoom meetings, using our Zoom platform, meet in person if you want. You can come here and meet in person, whatever you want to do. But the first thing is we decide. We want 1 cluster, 2 clusters, 3 clusters. You don't want to overdo it either. And we want to focus, and we want to have, at the end of this, a product, a report, something, and then an action item, what we're going to do with that. We just don't want to do a report and then, okay, so we did a report. And that's my pitch for that. Okay. And then another quick update I want to give, okay, we're good so far. So you all know, right, that the federal public health emergency is ending on May 11th. I don't know if that's good or bad. Well, it's good and it's bad because there were a lot of waivers that organizations and providers, hospitals and whatnot were using with telehealth and not having to have some additional paperwork done tied to that. One provision was the continuous Medicaid enrollment. That's going to end before the public health emergency. It's going to end tomorrow, right? And so, and that was because that Appropriations Act, that Consolidated Appropriations Act, the end of last year, but it was signed early this year, decoupled the Medicaid continuous enrollment from the PHE, right? It decoupled it. So on April 1st, states can resume Medicaid disenrollments. Why is that important? Because there are, I think on Long Island, close to 800,000 people who are on the Medicaid rolls right now, who for the past 3 years did not have to recertify because the government, and rightly so, felt this is not a good time for people to lose their coverage, and it wasn't. Well, now that's all stopping. So the Community Service Society of New York has pulled together some private funders to oversee a program, a massive outreach program called Keep New York Covered. And we applied to be to work on Long Island to do an outreach to communities. And so we are going to be one of those subcontractors on that grant because we don't want to see people lose coverage. And we have experience. We're an enrollment agency. We've been doing Medicaid, Medicare enrollment assistance for over 20-something years, right? A variety of programs. So we know how to do that. And then combined with the communications expertise that is from my neck of the woods in here, we were able to put together an enrollment outreach effort that's going to make use of traditional media, right? Those media relationships that I have. We're going to do transit advertising, right? Because we want to reach the communities that make sense to reach. We know where they are. We looked at the data. We know what zip codes they are. Flyers and work so social media, but again, you heard social media, you know, I'm not totally convinced social media is, you see the message, but I don't know if it resonates. But anyway, but we want those people who need to recertify to understand the urgency that they need to recertify. Now, albeit some people will recertify and their circumstances may have changed and they're no longer eligible. So then we need to direct them to the next level of care or a level of insurance, which might be to the marketplace, I would think. So that's what we're going to be doing. And I bring this up to all of you now because you, I'm sure, work with many Medicaid recipients, perhaps individuals who could qualify for Medicaid, don't even know it. And so we will be sending email messages about this and it just, you know, let the individuals you work with, here's a number to call, here's where you can go. You need to get recertified. We don't want you to lose your coverage. You know, we don't want you to get coverage because once that happens, it's not good.
And I'll just point out, while you're on that note, we do screenings for people who are uninsured. So if they do not requalify for research for Medicaid, they can come to us for breast, colon, and cervical screening.
Okay.
Prostate, we cover only after they've been diagnosed because the actual screening test is affordable, but the treatment is, so we'll cover the treatment if they're uninsured, and we do not ask for immigration status.
Okay.
So they can come to us for those screenings, no questions asked. They just have to be 40 for breast and cervical, 45 for colorectal. Brass, you can kind of maneuver if they have family history, but we'll talk about it case by case basis.
Yeah.
But just want to throw that in there, just while we were on the
And
topic
you're
of insurance.
Stony,
I'm Northwell.
you're Northwell.
Yeah, but Stony Brook does our screenings.
Stony Brook does the screening.
Yeah, they do some of our screenings, not all. They do, we fund their van and we fund their, like their van, if they go on the van uninsured, we're paying for that. Bless you. Bless you. Bless you. And some of their radiology facilities.
Okay.
So, yeah, we
Yeah.
partner with that.
And so now what you just said, I'm gonna jump ahead a little. All right, I'm done with this, right? So I can move on.
Oh, sure. Yeah, I know, I saw Gopina on there. She does the same thing I do,
Yes.
but for Stony Brook.
Yes, before you move on, I just wanted to ask, so are you with the BCCCP program?
No,
Oh, okay,
no, I don't even know what that is.
okay, I'm sorry.
But you'll have to tell me about it because I want to
So
learn.
now
Breast
this,
is
now that's,
cervical cancer.
this is what I mean about this collaborative.
Yes.
She doesn't know, you don't know what her program is.
No, but I'd
Yet
like
there's
to.
overlap, and that is one of the purposes of the collaborative. In addition to collecting this very localized data, which you all can use, that is one of the purposes of this collaborative. And you can't get that unless you're in a room together or on a Zoom together.
Exactly.
And as our team, the three of us here are from Long Island Select Healthcare, which
Yes.
is a federally qualified.
Yeah, I
health
know what that
service.
is.
So we can also encompass the uninsured and the underinsured.
Yes.
Yeah, we do take underinsured also.
Yeah.
We'll cover that.
So the Suffolk County Department of Health is a huge entity, and so we have many different divisions. So we have like Minority Health working on different programs for different communities that are faced with many disparities. We also have 8 federal health centers, the Sun River Health Centers,
Yes.
that are also located in some of these
Yes.
communities. The thing that I'm wanting to know is if everybody could give me some information about, their name, like the contact, their name, like, and what grants that they have, so that way maybe we can move residents to go to different programs, like even mental hygiene. We have a lot of people that come in for treatments, but then we also have a lot of people that go in for counseling, and some of them are filled to capacity, and so they need another place to go.
They need a referral.
Yes,
referrals. Yeah.
Yeah, so do I.
If I get-
So do I.
Yeah, so many years ago, we tried to be like a clearinghouse for all that. That was very difficult to do, one, because people need jobs, programs stop, and not everyone would be compliant in sending us the information, so the one way we kind of got around that, and again, understanding it's just the two of us, and this is a sliver of what we do, if you send us information about what it is you're offering, right, your services, an event or services, whatever, as long as they're free or subsidized, right? So we're not going to advertise some physician group that's holding a seminar on arthritis and they're charging $50. No, that's not it. So we put it into this bi-weekly collaborative communications with the logo of your organization and the contact information. That's at least a start. I hear what you're saying, something more comprehensive, something that might even be able to be updated in real time.
Yeah, because I think that even though the core clusters is a phenomenal idea, which I totally am on board for, we could help a lot more residents in different areas of
Right.
health if I could just direct them to like either the diabetes prevention program that we have running, or
Yes.
We have the screening with Stony Brook and I believe Northwell, so where they use mammo vans to go to different areas in Suffolk County.
Well, if you give us that information, we'll get it on, and then hopefully everyone reads what we send. That's another thing. You may see on our newsletter, whatever we call collaborative communications, read about her program, and you say, oh, that's a place I can refer there, and the same for you. It's not ideal, and maybe there's a better way to come up with it, and maybe that's a core cluster in and of itself.
That's a great idea, yeah.
maybe that is a core cluster. And how do we do this with limited funds, limited limited personnel resources, and make it up to date, right? It's got to be up to date. And there's a lot of directories out there, right? So there was the Long Island Addiction Resource Center, which put together all the addiction resources available, I think, in Nassau and Suffolk County, and there was a great person, Shari Santorelli, did that. That was a few years ago. I'm sure it's out of date at this point, right? Northwell has directories that they put together for mental health.
Yeah.
Through that health equity task force that I sit on. They may very well be out there. I mean, I don't know who's updating these.
We are trying to
You're
build, we're trying to build a resource guide.
See what I mean?
Yeah.
It's not
It's
easy
work,
to
it's in the
do.
works.
It's hard to do, and that's a huge organization like Northwell, and it's even hard to do. But I'm happy to entertain a cluster. I mean, if we could figure out a way to simplify it, and have it available.
I do have a bunch of resources that I can always email to you because in dealing in cancer services, we have to address your barrier before we can address, because we're part of preventative care.
Right.
Nobody's thinking about a mammo if they can't feed their kids.
Right.
So
That's another-
I have to address that first and then get you to your mammo. So I have all of these resources that I call, which is why I sit on these things, because I may have to call you, I may call you, because it could be something so simple as, because I had one woman who wanted to get her daughter into a theater group, and that was her main focus. So I'm like, I'm literally calling people at the theater and like, okay, what's the, but you would think it's not associated with a mammo, but it is, because she's not concerned about it until this is gone.
Right.
So, so anywho, so I utilize all of these resources. So Cleopatra's on the call. She's my partner in crime, my right-hand man, and then there's Danielle.
Hello.
So Cleo is doing our resource guide right now, but it's on our shared drive. So she can always give you access to it or email it to you. We do update it in real time between her and I. So it is updated almost daily between her and I.
It's a big job.
It is a lot. You should see it. And she is so good because everything is subdivided. So it'd be like rental assistance, Medicaid discounts, doctor resources, or solely for Alzheimer's. It's even broken down like Huntington resources, minority resources, senior only resources. And then sometimes they overlap, but they're all still in a different, so she'll copy it and then put it in whatever one it applies. She's really good. Very good.
So is that, you said it's in your shared drive?
That's in our shared drive, so like you couldn't have
Right.
access, you have to ask me or Cleo to give you
Perfect.
Well,
access to it.
If we did a cluster on that, that would be something that maybe we could then hyperlink to, right?
Right.
So, and explain, if you hyperlink to this resource, you will need to gain access to their shared drive. Here's the person to call, or here's the number.
Yeah.
Yeah.
Is
You know,
that shared drive Google by any chance?
No,
Okay,
this is
good.
Northwell, honey.
Another resource is the Height site, right? And I have been a great proponent of the Height site. That's a health empowerment tool, HITE, health information tool for empowerment. And it does cover Long Island. It is maintained by a New York organization that has a good number of staff now that update it all the time. You want to, maybe if we could pull it up? And I actually have information cards about it. I've told so many people about this that, social workers, caseworkers, that you would think they would know about it, and they don't know about it, and it's very easy to use. There it is.
That's great.
And it's not just New York City, though. You'll see if you click on it. Okay, so you go by cat, I don't know. So let's look at housing, do housing, whatever. Just click housing. All right, now, keep going. There's a way to filter it. Distance, you do by distance, difference or relevance, right? It does have it covers Long Island. I know it does.
You know why? Because through our VPN, we're in Albany. I think might be the problem.
Oh, I mean, you don't know these, like, but anyway, maybe housing.
Oh,
was-
there's some
But we
Long
can change our location. No, you're.
Sorry, my Zoom window is like. in
See,
the
there's
way.
Levittown, right, the Long Island Center Independent, and it gives you, and this, they are up to date on this, right? They're constantly, yeah, then you can suggest a resource and send it to them, they'll vet it, and then they'll put it on. I have found this particular, let me go get those cards that I have. That and 211 with United Way. Does United Way was here. They still do 211? They still
Yes,
have-
they do.
I was just at their
During
meeting.
COVID, they had slowed down because
Yeah,
it wasn't
let me
as
go-
up to date.
Just hold on, let me get these information cards.
I was just at their meeting like 2 weeks ago and they're trying to revamp it a little bit.
Yeah, because I know it was really outdated for a while.
But in the
Brooke.
meantime, send any information.
Brooke,
Yes, Dorothy.
you, the young lady who was talking about the open Medicaid enrollment, the one who just spoke,
Yes.
is it for, I know she said it's uninsured and underinsured. Is it for individuals or it's for family groups as well?
I don't know if she's talking to me or talking to her.
No, I didn't talk
About insurance for underinsured and, I would think it's for individuals, not so much for family groups.
Yeah, you're not gonna.
Mine is for individuals.
Okay,
You have to be 40 for breast and cervical. You have to have no insurance.
okay,
For instance, this is like a underknown one, but if you have insurance that only covers screening, but you need diagnostic, and so that we will cover as well, because once you come to us, even with the screening memo, you need further diagnostics, we pay for that diagnostics. And if you need treatment because you've been diagnosed, we do have a Medicaid plan that we will offer you to get your treatments covered. And we also at that time do bill assistance, rent assistance, grocery stipends, all of those other things, support groups, because we want to take care of the whole person and not have you worried. So it's more of an individualized thing. Colorectal is 45. But there's also things like, with breast and colorectal is a little bit dependent on your risk factors because 45, we can either send you a fit kit if you're low risk, 40 or high risk, we'll send you straight to a colonoscopy. So it's very much individualized. It's on a case by case basis. So yeah, just when in doubt, just call.
okay, thank you.
And this presentation, Jackie's presentation, everything we're talking about today is recorded. We send a summary out at some point, right? And the slides, so you got all that. I know we're pressed for time here. I'm gonna go real fast. I told you about collaborative communication. Send us stuff, but at least give us, it's every 2 weeks. So I don't know what the schedule is exactly, but we need at least a week's leeway. You can't like have an event happening tomorrow and you send something to us today because it's already gone. And the calendar, we have a calendar, you submit your events. It's easy to do, it's on our website, we put it up there.
That will be linked in these slides when they go
Right.
online. I forgot that one link.
Walk with the doc, safe with the doc, right? We hold a lot of those with other organizations. We've done it with Stony Brook, we've done it with Suffolk. And that's an opportunity. We get a doctor, and this is a national movement called Walk with a Doc. We established a chapter here on Long Island some years ago, and we find a location. The doctor goes on the walk, gives a little information about a health issue, maybe it's high blood pressure or arthritis, whatever it is. And then we take everyone on the walk. It's all free. We will partner with your organization to do that, and we handle everything, right down to the promotional materials. You just have to help co-promote it, and it's a great exposure for any organization.
Where is the walk? In the community?
In the community,
That's amazing.
any place that you think,
Different communities.
any
Wow.
community you want to go, we've been everywhere.
Great. Oh, I love that.
Okay, let's go to the next, and then we also have one of the collaborative participants is AARP of Long Island. And we've been working with them, and we hold these online I mean, it's just examples of what we can do with everyone, to an extent, right? Again, remember, it's just broken. So we set these up there, we call them Talk with the Docs, and we've gotten somebody from all of our hospitals. Northwell has Dr. Keisha Guerrier, do you know her?
No.
She's phenomenal.
No.
Oh, my God.
No, I'm
She
lying.
has done so many walks for us. She's phenomenal.
Thank you to everyone in
Yes.
this room on this call who helped us
Forget
secure these
This is not
doctors.
easy to do, so those are coming up. And then as a follow-up to that, we have Walk with the Docs in very local, easy to access locations. Dr. Linda Mermelstein, who's on the call.
Thank you, Dr.
Mermelstein, is holding one on May 27th. We actually hunted her down when she was in San Francisco or San Diego or someplace, and I was like, please, you have to do this to me. And she said, yes, I will. And she's the former Deputy Commissioner of Health for Suffolk County.
Oh, wow.
Yeah. So, all right, so there's that.
My pleasure.
And then there's another organization we work with, the New York Coalition for Transportation Safety, and we are helping them put on a summit about the Walk, Bike, Long Island Summit, and they're all about pedestrian safety education. And why is that important, and why does that fit in? Well, because we said exercise, mainly walking, is a great way to avoid or better manage chronic disease. So you see how it's all interrelated.
Yeah, and we are offering tables at this event for
Yes.
free. If this aligns with the
what-
work that you do and you feel it would be a good fit, please reach out and we'd love to have you there.
And it's at Farmingdale State College. And then lastly, we have our list of quarterly meetings. And for those of you who have been with the collaborative for many years, that's you, Harriet. Look who's going to be speaking. Sarah Ravenhall, who was a program manager here for the collaborative some years ago. She was stolen from me, basically, and became the executive director of the New York State Association of County Health Officials. So she's very much in the public health realm. So she's going to come here and talk about, and she's going to come in person, she promises me. She's fantastic. She's won awards. She's amazing. She's amazing. And she's going to come here on June 29th, and she's going to talk about public health and local public health agencies working with the community-based organizations and the hospitals and all of that. And she recently had some kind of a peer-reviewed journal article published. And I think it might have something to do with public health agencies and
We'll brush
and
up on her
COVID or
accolades.
something, or pandemic or something like that. But anyway, so she's coming.
Yeah.
I'm trying to get her to bring her little
Please,
baby
I
with
want to
her.
see, I want to see too. Babies, I'll babysit.
I told that, I said there are plenty of people here that will babysit.
Oh, you'll babysit.
She has she has a 6-year-old, he's almost 6, her oldest, and her baby will be 2 in May. I said, I've never met her daughter, I met her son, I said, please bring him, but she's planning on visiting the Suffolk County Health Department and the Nassau County Health Department, so I don't think she can bring.
I think she was pregnant with the first when she left you guys.
I don't think my boss would be happy with that, but anyway, so we're very excited to have her come down, she's fantastic. She's
Janine, I
fantastic.
think she was pregnant with her first when she left you guys.
You what?
I think that Sarah Ravenhall was pregnant with her first child when she left you guys. When she left to go up to NYSHO, I think.
No, she had the baby in June, then she went on maternity leave, and she came back from maternity leave, and she said, guess what, I'm leaving.
Okay. I just remember there was some proximity there.
Yeah, they had recruited her as she was on maternity leave, and it was just too great an opportunity. I said, no, that's great, you have to take it. So that's what happened. And I had just 2 other things. I had the Alzheimer's Association released its facts and figures report for 2023, so you might want to search around for that. Oh, and Northwell is holding these focus groups. Do you know about this?
Yes.
They're holding focus groups. They want to revise the medical school curriculum. It's going under a renewal process. And they have open focus groups. You have to register April 19th in the evening via Zoom. I can send you, we'll send you the information when we send anything out. And they want to find out, like, what do you want the doctors of the future? You don't want them to be avatars, obviously, but what do we want the doctors of the futures to be like? What do they need to know? So that's that. And then there's a Spanish one on April 27th, but I don't have a flyer on that one yet. So I just thought I'd tell you about those. If I can do that, I think you're gonna do this, right? You know, because, you know, we have to have our doctors understanding. They need to understand we're in a very culturally diverse area. They need to be aware of the health inequities and the disparities that exist. I don't know that they're always aware of that. I don't know if that's being taught in the medical schools. So I think.
And bedside manner is another thing
Yeah.
that needs to come back, like
Yeah.
old school,
Old
because
school, yeah.
whenever I go in as a consumer and I see a doctor has good bedside manner, I tell them, especially if I'm
Yes.
taking my child or my
Yes,
parents.
yes.
And the student that's behind them, I say, you see this? That's why we come to them.
Yeah.
Because the younger practitioners are so focused on data sometimes
Yeah.
or technology or, you know, that they forget that, you know, you need to
You're a
build that
human
trust with the
being.
patient. Well, they need
So
to build
I
that
find it
trust.
The older ones, because the older ones are mean.
Really?
To me, the older
That's
doctors.
because they have to do too much insurance paperwork. They're crazed by, that's another whole, let's not even go there.
Can I have a few of these?
Yeah, sure, have a few, take a few, anybody can take these, pass them out, that's what I want you to do, give them to your social workers, your case managers. So that's it, we kept you here, I'm sorry,
No,
extra
it
20
was
minutes.
great.
Uh,
Thank you.
Yeah,
But
thank you
I
all
hope
for
you got a
joining
lot
us.
out of it, I'm happy
Yes.
to see you all here. Take a snack on your way out. Great to meet new faces, great to see some of the faces. And it'll be real interesting to have Sarah here, I think it's gonna be good.
Yes.
Yeah.
So did you
Okay.
send those slides that have
You-
the emails? I
Yeah.
was taking some